Board certification review. So, and this is the review course. So, everything you need to know for the purpose of emphasis. So, we'll start by talking about pharmacology today. And pharmacology is very important, especially as providers, because we have to be prescribing medication. So, we have to understand the drug interactions and be able to manage our patients well. So, a few things we are going to go through, and one of the thing is beta blocker. Beta blocker is very high yield in the exam. So, example of beta blocker is metoprolol and atenolol. So, how does this medication work? It blocks the beta adrenergic receptor in the heart, reducing heart rate and myocardial contractility. So this medication helps to reduce heart rate. So anybody that the heart rate, we know the normal heart rate. So when it's very high, when somebody is having like 100 and above, we usually want it between 60 and 200. But when it's higher than that, then the person is having a high heart rate. So this kind of medication helps to reduce it. And also it's used for the management of hypertension, angina, and heart failure. So you need to know the contraindication of this medication, very high yield in the exam. And what is the contraindication? Do not give it to patients that have respiratory issue. Example, COPD, asthma, emphysema. So any of patients that have those issues, you do not give it to them. And other things you need to remember about beta blocker is that beta blocker marks hypoglycemia. So you have to be careful and or use it with caution for patients that have diabetes, because it's going to mask hypoglycemia. Also, beta blocker, like we know, as it reduces heart rate. So you have to be careful, especially like we said, patients that have respiratory issues. So we have another one that is high yield in the exam, AC inhibitor and ARBs. So you need to remember that AC inhibitors and ARBs, we don't give it together. So they can ask you, a patient is on lisinopril, which is your AC. Which of the following medication is contraindicated? The answer will be lexatan, because losartan, because you can't combine both of them together. And another thing is that you need to remember that there are side effects of AC inhibitors. Those side effects are angioedema and cough. So, for that angioedema and cough, when a patient develop it, and we know that angioedema is like a medical emergency, you have to pay attention to it. When they start having swelling of the mucous membrane, and the cough usually starts within 2 weeks after they are on this medication. But if they develop those cough, angioedema, then you can change it to apps. Apps are those satans. We call it a losartan. Another important thing is that this medication is you have to is contraindicated for women of childbearing age or people that are pregnant. We don't give it in pregnancy. So if you have a patient that is pregnant or have um a high at risk at which is the childbearing age, it's always good to discontinue it. Another important thing for ACs and ARBs is that they can affect the kidney. So if the kidney is not functioning well, you shouldn't give it to them because it causes hyperkalemia, high potassium. So those medications, one of the things you may be looking at is patient need to avoid potassium supplements. or potassium salt. So anything that increases the potassium is very, very important to take note of that. Then we have our calcium channel blocker. Calcium channel blocker will still, because everything we are doing is just a summary. You can still look at the videos, other videos for more in depth of all of them. For calcium channel blocker, you must know the two types, dihydropyridine and non-dihydropyridine, which is very important. And you also need to know the that calcium channel blocker causes vasodilation. So because it causes vasodilation, you need to look at things like side effects of headache, flushing in the face. They also causes constipation and peripheral edema. Constipation, peripheral edema. So we use it for the treatment of hypertension and is usually um, the first line also for African America. So when you look at the hypertension treatment guideline, we say that thiazide is usually the first, because thiazide, it reduces it by zero point 0.10. Okay, but then for African America we have other first line, which is thiazide, then calcium channel blocker. So calcium channel blocker is really good for black people. So you need to monitor the side effects, which we say constipation and peripheral edema. So sometimes I use the first two letter to remember the side effect. C is constipation, and A is ankle edema, which is that peripheral edema. So very important. The same way I use the first two letter to remember for ACs, like A is the angioedema, and C is the cough. Okay, that dry cough. So always remember the side effects, very important for the exam. Then we know the guideline, and the guideline is that for the non-black, the first line is usually the thiazide, the ACs and ARBs and calcium channel blocker. This is very important because so many people think that the first line is usually just thiazide. It's not only thiazide, because thiazide can only reduce it to like 0.10, like I said. So if you have a patient and the patient is a healthy patient and the patient is greater than 60 years old, we want the blood pressure to be less than 150/90. But if this patient, the blood pressure is over one, like let me say 170, so even if you give them calcium channel blocker, the most it can reduce it is 0.10, which is 160. So they are still not in their guideline. So that is why you now have to try other thing, which is the ACs and ARBs and the calcium channel blocker for non-black. But for the black people, um, we use thiazide and calcium channel blocker for the black. Okay. But people that have any chronic kidney disease, so if you remember the guideline, it doesn't matter the age, it doesn't matter the race, as long as the person have um hypertension with chronic kidney disease, with or without diabetes, their guideline is usually less than 140/90. Okay, less than 140/90. So these people, you are going to add ACs and ARBs. Very important to for them, because you want to, it's a it protects the kidney. So you add ACs and ARBs for them because it protects the kidney. So that's very important. Then the calcium channel blocker, I mentioned it before. We have the two types, non-dihydropyridine and dihydropyridine. So this non-dihydropyridine, I always remember it as VD. Okay, verapamil and deltazem, VD. But the dihydropyridine, that is the one I remember as NA. So nifedipine and amlodipine. So nifedipine, NA, and amlodipine. Then I remember this one as VD. So sometimes you can be asked the classification, so you need to know. And also, we know that calcium channel blocker is contraindicated for patients that have GERD, and also any condition where there is it worsens heart failure. So it worsens heart failure, it worsens GERD. Okay, so but the only one, and also in the cases of pregnancy, the person is already having a lot of fluid retention. So the one that is safe in pregnancy is your nifedipine. So you can give them nifedipine in pregnancy. Then let's talk about the calcium channel blocker consideration. Like I said, it's very important to remember is a vasodilator. And as a vasodilator, it can cause hypotension, peripheral edema. I have emphasized on it before, constipation. And also remember that this that they need to avoid um, the fruit, grapefruit. Okay. Then we have other antihypertensive agents. Example, hydralazine. So hydralazine is always used in emergency situation. It dilates the arterial smooth muscles, and they can also use clonidine. So this is our AC inhibitors, like we have said before. So we use it for the management of CHF, and also you need to remember the side effects. So what are the side effects? The side effects, it can cause vasodilation, the angioedema. Once you notice the angioedema, which is those swelling, they need to stop it right away. Okay, then it's contraindicated, very important, in pregnancy and bilateral renal artery stenosis, very high yield in the exam. Bilateral renal artery stenosis and pregnancy, we have said it. So even if they say the patient is woman of childbearing age, the patient is a woman of childbearing age, and patient is on ACEs inhibitor, you need to stop it. So the same thing, ACs and ARBs are talking about the same thing. So it's the same contraindication. Then we have our diuretics. You need to know our diuretics, and the high yield one is hydrochlorothiazide. So always understand the side effect of hydrochlorothiazide, because it's very high yield in the exam. We have other thiazide, loop diuretics. So the loop diuretics is more stronger than hydrochlorothiazide. So if the person have more like heart failure, they have more fluid, it's always good to use that. Then we also have the potassium sparing diuretics. The potassium sparing diuretics is the spironolactone. And what do you educate them here? They need to avoid potassium salt. So they need to avoid potassium salt because it's a potassium sparing diuretic. And another high question is, what are the side effects of spironolactone? The side effect is GG, gynecomastia and galacturia. Gynecomastia and galacturia. So when you talk about the side effects of a thiazide, hydrochlorothiazide, you need to understand all the side effects. It can cause hyperkalemia. It can cause hyperglycemia. So you have to use it with caution for people that are diabetic. It can also cause hyperlipidemia, which is high triglyceride, high lipid. It can also cause or cause gout, hyperuricemia. It can cause gout, but it's very helpful in the cases of osteoporosis. So it helps with osteoporosis. Then when we talk about penicillin, you have to know penicillin for the exam, because most of the, especially under skin, I mentioned under skin where we can use amoxicillin. But we have two penicillins you need to remember for the exam. which is penicillin VK. The penicillin VK is for people that have strep throat. Then we have penicillin G. Penicillin G is for treatment of syphilis. So remember those two, penicillin VK and penicillin G. And another important thing is to know that they're often used for first line treatment. So it's either you do penicillin or Keflex. So they're usually used for, except if the person is allergic to penicillin, or if they are allergic to penicillin, so they cannot get Keflex, or they cannot get augmentin because it contains the same the augmentin contains amoxicillin quavelic acid, so which is that amoxicillin. Then for cephalosporin, cephalosporin is a medication you must know for the exam, and it's have five generation: first, second, third, fourth, fifth. For the purpose of the exam, the fourth and the fifth is usually IM and IV. So I won't advise you to crack your brain in those ones, but you need to know the first, the second, and the third. So the first is usually where we have um the careless, and you know that careless is very important for the exam. We also have the second generation, the third generation, where you have the ceftriaxone. And ceftriaxone, we always use it for example STD. So you also need to know about the macrolide. These are the antibiotics you need to know for the exam. You also need to know about macrolide. So under the under the macrolide, you need to know the macrolide. Example of those macrolides are those azithromycin, clarithromycin, and like I said, it's a very high yield in the exam. But one thing I always say is that macrolide is used in so many conditions you will see in the exam. For example, the treatment of pneumonia. So if you talk about community acquired pneumonia, you will see the treatment of, you will see they use macrolide. Then when you talk about atypical the pneumonia, you will still see macrolide. So macrolide is used for pneumonia, very important in the exam. Macrolide is also used for STD. When we talk about chlamydia, chlamydia azithromycin. Okay, so most of time is always important to remember when a patient is allergic to Keflex or amoxicillin, then they can get macrolide. And the good thing about macrolide is that at this point, it is safe in pregnancy. There is no study that has said that it is not safe in pregnancy. So in the exam, even if they ask you about STD, UTI in pregnant women, so you will still see that they can use macrolide for that. But one thing you need to remember about macrolide is that macrolide interact with so many medications. So for me, that is one of the secret. Anytime there is a question on drug interaction, especially in the option, I will tell you that macrolide has a lot of drug interaction. Okay, so always look out for that. Then we have the fluoroquinolones. They will ask you questions on fluoroquinolones. So those fluoroquinolones we have the ciprofloxacin, levofloxacin, gemifloxacin, moxifloxacin, and very important, we use it for complicated UTI. So let's start from the fluoroquinolones. We can use it for pneumonia. So if you remember the atypical pneumonia, the acronym that we use, if you follow the other studies that we did, you find out that we have we can use fluoroquinolones for the atypical pneumonia, so which is levofloxacin. And under community acquired pneumonia for people that have comorbidity, if you remember the acronym we have, we say that they also use GM. So what is that GM? Gemifloxacin or moxifloxacin. So for treatment of pneumonia, you can see it in the exam. Also for treatment of UTI in the example, somebody that have community complicated UTI. We say that complicated UTI are seen in men. So complicated UTI, you will use um, fluoroquinolones. But the side effect of fluoroquinolones is very important. It can cause tendonitis. We call it Achilles tendon rupture. Okay, so when that elderly patient is on fluoroquinolones, or that child that is less than, we don't want to give it to children or pregnant women because of this risk of Achilles tendon rupture. And also, it causes QT prolongation. So these two side effects is very high yield, very, very high yield. Then you need to know your insulin. Of course, we you can see it in the exam. You need to know the ones that is the rapid acting insulin, short acting insulin, intermediate acting, and long acting. So you need to know them. If they give you as example Lispro, you need to know, is it long acting, short acting, rapid acting, intermediate, So you need to know your insulin. Very important. Then we have all our hypoglycemic medication. Metformin is a high yield question. So metformin is the first line of treatment for type 2 diabetes, because why? It's very cheap. Okay. But you need to also know that metformin can reduce the hepatic glucose production, okay, and improving insulin. So, if you talk about the side effects of metformin, you talk about GI side effect, nausea, diarrhea, and also it can cause lactic acidosis. So, very important. So, we have other hypoglycemic um, agents, SGLT2, and also the DPP4 inhibitors, and the sulfonylurea. Okay, so under sulfonylurea, we have the glipizide. So I want you to know, in case if they ask you a question, the one that is cardiac protective, like the one that is cardiovascular protection, those are the SGLT. So we we see Wegovy being advertised. So all those ones, you need to remember them, the ones that are cardiac protective. Then we have the psychotropic medication. We talked this one in depth. The SSRI, the SNRI. So you must know SSRI for the exam. And we broke it down. We said Paxil, sertraline, escitalopram, citalopram. So we know that SSRI causes serotonin syndrome if you combine it with some medication or some herbal supplement. So if you combine it with MAO, TCA, so we talked about all these things in mental health. So remember that, remember the serotonin syndrome, SSRI can cause that. And we say that patient will have symptom of hypertension, fever, um, myoclonus, hyperplasia, and diarrhea. So those are the symptoms. Then it causes weight gain and sexual dysfunction, so erectile dysfunction. So this patient on SSRI, what can you give them to prevent the sexual dysfunction? They give them Wellbutrin. Okay, Wellbutrin. Then we have our SNRI. SNRI. So you have to always remember this one. And I the one of the major medication here is duloxetine. So when somebody have depression and chronic pain, depression and chronic pain. So how I always remember it is duloxetine dual is doing two things. It's not just helping with the depression, is also helping with their pain. So sometimes I use this N in the middle to remember neuropathic pain. So this is the one that we use for neuropathic pain, but N means not epinephrine, but that is just how I used to remember it. So duloxetine, it is doing two things, both depression and also um pain. And another important thing is that this increases both the serotonin and the norepinephrine. Okay, so it may cause blood pressure. If you look at SSRI is only increasing the serotonin, but SNRI is increasing both the serotonin and norepinephrine. So you need to monitor the blood pressure. So we have our antipsychotic, which we also talked about in details. We said we have the first generation, that is where we have the HCT, the acronym, which is the haloperidol and chlorpromazine. So, and then we have the second generation. The second generation is where we have our Cypressa, Seroquel, Risperdal, okay, and we have Abilify can be in this second generation and also can be in the third generation because it has more other properties than the second generation. So we said that in the first generation, the patient is high risk of EPS and neuromalignant syndrome. So NMS. So patient is at risk of these two things: EPS, extrapyramidal symptoms, and if you remember that tardive dyskinesia, lips marking, okay, pseudo Parkinsonism. So all those things we talked about, extrapyramidal symptoms. Then the neuromalignant syndrome, which is due to too much antipsychotic. Patient is going to present with hypertension, fever, like sign of overdose. But the buzzword here is rigidity. Rigidity. And we also mentioned rigidity and the WBC and the creatine kinase. Okay, so those are the things you have to look out for. Then we have the second generation. Second generation is where we monitor more of metabolic syndrome. So we said it causes weight gain. So under metabolic syndrome, what are the things to remember? Hypertension, because metabolic syndrome is just a collective conditions in one. So patients can have hypertension, hyperlipidemia, obesity. So you see, you are not just treating only hypertension. You are treating hypertension, you are treating hyperlipidemia, you are treating obesity, and these are the things you look out for in metabolic syndrome. So even the weight gain, the obesity. Then we have our mood stabilizers. This is um, one of the ones we must know. The lithium. Lithium is the gold standard. So whenever you are talking about mood stabilizer, we say that in when somebody have bipolar, patient is under two poles. So the two pole is manic and depressive pole. So when they are in that their manic pole, lithium is very important. So lithium is the gold standard for bipolar. But for lithium, you need to monitor you need to know the labs to monitor. Lithium have a narrow therapeutic index. So you need to know that it's possible just a little shift can cause toxicity. So you need to know the signs of toxicity like those tremor. Okay. Then you need to or know the tremor, the diarrhea, and know the labs to monitor for lithium, TSH, because people that have manic can present, people that have hyperthyroidism can present as manic patients. So monitor the TSH, monitor pregnancy, monitor the renal, that as in do the pregnancy test, which is always the number one thing. Then TSH, then the kidney renal function test. Then we also have the anticonvulsants. We have the valproate and the lamotrigine. Lamotrigine is also always used for the depressive state, but always remember that it causes rash. It makes patient to be at risk of Steven Johnson syndrome. It causes rash. Then we have our benzodiazepines. Under the benzodiazepine, we have the lorazepam, we have the clonazepam, and the others. And we say that these ones, we use it temporarily before the SSRI start working in. Patients have high risk of addiction. So that is why it's very important that it's just used for a shorter period. Then know your analgesics NSAID. There's a lot of questions on NSAID. We can use NSAID for gout, which is the first line treatment for acute gout. But then know that NSAID can affect all the system. Gastrointestinal, it can cause bleeding, renal impairment, it can affect the kidney, cardiac vascular, it can worsen heart failure, it can worsen hypertension. Okay, so the only system that is doesn't affect is the musculoskeletal system. So know your NSAID, and the examples of your NSAID, and the risk of NSAID. Then pharmacokinetics is, if you talk about pharmacodynamics and pharmacokinetics. Pharmacodynamics, if you spell it D in the middle, is drug. So pharmacodynamics is if what the drug does to the body. That is the simple definition. What the drug does to the body. Why pharmacokinetics is what the body does to the drug. So these are the examples: absorption, distribution, metabolism, excretion. But what you need to know here is the definition. Pharmacodynamics, what the drug does to the body. Pharmacokinetics, what the body does to the drug. So you also know that with geriatric patients, you are monitoring the pharmacokinetics, what the body what the body does to the drug. So for older people, they have, as people age, they have slow absorption, distribution, metabolism, and excretion. So that is why it's very, very important to start from low dose before going to high dose. And also, they are at risk of polypharmacy, because polypharmacy, this patient may be taking multiple medications. And like we said, some of those medications can interact with another medication. So, medication reconciliation is very, very important. Then you need to know the beer criteria. The beer criteria is a guideline that identify the potential inappropriate medication for old people. For example, instead of giving the patient Benadryl for antihistamine, which is the first generation, you can give the person Claritin, right? Natidine. So for another generation. So it's so important to know the beer criteria. Then for pregnant women and lactating women, always know the medication that is tetragenic. We have talked about it, ACs and ARBs. Another one is Accutane. Some antibiotics are not safe in pregnancy. So these are the things you need to know. What medication can a pregnant woman not get? What medication is safe in pregnancy? But always remember, if a pregnant woman have UTI in the first stage of the pregnancy, first and second trimester, we give them macrobade, which is your nitrofurantoin. But nitrofurantoin is contraindicated in the third trimester because it causes hyperbilirubinemia, high bilirubin. Then, if the patient is at the third trimester, you want to kick the baby out, so we give them Keflex. But if patient is allergic to Keflex, you can give them azithromycin, and that was what we said. Azithromycin or can be used. And also, for pregnant women, if they're in their first and second trimester, you can use fosomycin because that is the new one instead of using macrobate. Then you have to know medications that affects the kidney. We have talked about it. The ones that affect the liver, something like lithium, something like acids and herbs. So all those medications that can affect the kidney, you need to know to monitor renal, or the ones that can affect the hepatic. It's important to do the liver function test. So this is the comprehensive drug interaction. So these are the ways the medications can interact. So just know your pharmacokinetics in summary, pharmacodynamics, then QT. Some medication can cause QT prolongation. Okay, some antibiotics like the macrolides, some antipsychotic, then serotonin syndrome. So also know your Parkinson disease and the medication. So what is Parkinson disease? Is a progressive um, degenerative disease of the dopamine. So what do we give them? We give them levodopa, which is a carbidopa. So this patient is going to have the pure rolling tremor, which is a tremor at rest. They are going to have a rigidity, rigidity, and they are going to have bradykinesia. So always remember the medication that we give them. We give them levodopa. We give them dopamine agonist. We give them anticholinergics, example benzotropine, and we also give them the enzyme inhibitor. So let's go to the next one.